One of the ways we try to maintain safety is to make sure that we're giving the right medication at the right time for the right reason to the right person. We call these the rights of drug administration. Many times it is referred to the 7 rights, but that can vary depending on the source that you are referencing. Now, the reason for this is because as of 2020, more than 7,000 people are directly being killed because of medication errors, and thousands more are being injured or otherwise hurt because of medication errors. In addition, there are many cases we know of where there is no harm to the patient at all, and yet the medication was either given in the wrong dose or the wrong time or even to the wrong person. A large percentage of these errors are actually attributed to the prescription itself. However, other errors are attributed to the actual administration of these medications. The first of the 7 rights is the right drug. A couple of things to think about. Generic names can sometimes be complex and confusing. Trade names can be sound alike, so it is very important that we very carefully look at the name of the medication and see exactly the same as what is being ordered by the provider. If you're a hospital nurse, the drug name should be compared against the drug order 3 times when the drug is being taken from the medication cart, when the drug is being poured into the cup, or it's when being placed into a cup, and right before the medication is given to the patient. These are known as the 3 checks. The next right is the correct drug form. Now remember, the same drug can be in different forms. It can be oral or liquid, and liquid can be given in IV or IM. So it's important that the administrator understands which form should be given. Calculating the drug dose is a very important component of giving the right dose. Standard adult dosages are preset by the drug company during clinical trials. However, there are patients who fall outside of drug dosage range, and they may have to have their drugs adjusted on a very frequent basis. These include the elderly, the too thin, and the too obese. Pediatric dosages are based on the total weight of the patient, not of the age of the patient. This is especially true for premature babies. And as you might imagine, this has to be calculated with very great accuracy. They need to be recalculated periodically when the child is on long-term drug therapy because of growth and development. Chemotherapy drug doses are based entirely on the patient's total body surface area. Customized doses for each patient are used to maximize the effectiveness of the drug, and this minimizes drug effects. If I'm very careful about what dose I'm giving, I can give just enough of that drug to cause a therapeutic effect, but not enough to cause the adverse and or side effects that are common. Important to check to make sure that I'm using the correct route of administration and that the drug form is compatible with that route. I do not want to try to dissolve a pill into a liquid form that's going to be used for intravenous. Pills can only be used for oral administration. Another is the right time, and this is measured as the frequency in dosage. There are a number of commonly used abbreviations that indicate frequency, and they are based on Latin phrases like Q day or at night. Another of the rights is to give it to the right patient, to make sure that the person who needs the medication is actually the person who's getting the medication. In home situations, dispensing to yourself or your family member is not difficult. However, in an acute care facility or in a long-term care facility where the nurse may be responsible for dozens of patients, patient identification becomes crucial. Lastly, there is the right documentation. This is done only after the drug is administered. The information should be entered on the patient's medical or medication administration record, that is the MAR. The drug's name, the form of the drug, the dose, the unit of measurement, the route of administration, and the time should all be entered on the medication administration record, and the name of the person who actually administered that medication should be included as well. Drug recalls occur because the effectiveness and safety of an approved drug are still monitored by the drug company and the FDA. Recalls occur because the drug does not contain correct amount of the active ingredient, or the drug does not remain stable until after the expiration date, or the drug label is incomplete or inaccurate, or the drug is contaminated with particulate matter from the manufacturing process, or it is found to be related to adverse drug reactions, or it is found to have caused illnesses or deaths. Drug companies now need to notify providers, hospitals, pharmacies, and news outlets for consumers. However, the drug companies are not responsible for the disposal of those medications. That brings us to the storage and disposal of medications. Heat and moisture can degrade the active drug if it's stored in medicine cabinets, like in the bathroom. Flushing drugs down the drain can contaminate groundwater. Many pharmacies will accept unused drugs and dispose of them at no charge. Some police departments have a program to dispose of opioids or scheduled drugs. Some tips on how to dispose of a medication. They should be crushed or dissolved in a small amount of water. They can be mixed with coffee grounds, with kitty litter, or another inedible substance. And this should be mixed in a sealed plastic bag and then put in the trash. If needles or syringes are being used, a sharp container should be used. And this is an example of a biohazardous waste receptacle.